This is Randy Wyckoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID-19 pandemic update with data accurate through October 21st, 2021. This week, I'm going to continue what I did last week, which is sort of answer questions that I get asked. I'm going to give as many yes, no, or I don't know answers as I can in 3 minutes. And then I'm going to do a 2-minute update on the pandemic. So in terms of the yes, no, I don't know questions, because I'm just giving very brief answers, I want to be sure that you understand that these are my personal opinions. They don't reflect the opinions of other groups, including my employer, the CDC, WHO, or anyone else. I don't have enough time to explain every answer, so I'm just going to tell you what I think, and we'll go with that. All right, so I'm going to start my 3-minute timer. Have I been vaccinated? Yes. Have I received a booster? Yes. Do I think we should mix vaccines for the booster? The answer is no one knows at this point. Do I think everyone should be vaccinated? Yes, except for those who have a legitimate medical condition. So to that end, do I favor a vaccine mandate? Yes, maybe. And the reason I say that is that I certainly favor it. We know that most people who are not vaccinated are not anti-vax, they're simply hesitant, and a vaccine mandate helps them. However, if someone really doesn't want to be vaccinated, then I think it's fine for them to be tested every 72 hours or once a week or something like that. Do I wear a mask in public places? Yes, I do. Would we be safer if public places required evidence of vaccine or a recent negative test and required masks? Absolutely, no doubt. That's what they do in many European countries, and it seems to be working quite well. Do I think that schools or universities should move to online instruction? No, I don't. I think there's sufficient evidence that there is a loss to students if they lose the face-to-face instruction. Do I think it's safe to travel by car? Yes, generally. I wear a mask when I go into the gas station. But by plane and overseas, it really depends on where you're going. Some countries require evidence of a vaccine and wearing masks before you get on the plane, in which case I feel pretty safe. Others don't, in which case I don't feel so safe. Do I think the pandemic will end soon? Soon in the sense of a few months? No, I don't. Do I think it'll ever end? I don't know. I think the best evidence right now is it'll probably become a chronic condition. Do I think we'll ever have an effective antiviral medication and treatment? Probably. Just as we've been able to make HIV/AIDS a chronic manageable disease, I think we may do the same thing with COVID. But do I think an antiviral medication will be better than the vaccine? No, I don't. I think the vaccine will probably be the best tool that we have. Do I believe that ivermectin or hydroxychloroquine work? No, I don't. Would I take them if I were seriously ill and had no other options? No, I wouldn't. But here again, there's a caveat, and that is if new information is gathered through the rigorous process of clinical evaluation, then I would reconsider. Do I think we're being purposely misled by purposeful misinformation? Yes, to some extent. I think there are some people who truly believe alternative views, but I also believe that there are many who are doing it, who are spreading misinformation for purposeful reasons. It's causing a great deal of public confusion about who to trust, and I think it's aggravated the existing divisions in our country, which really worry me, because we are a nation, a civilized nation, who gets through our problems by collaboration. Do I think legal or regulatory action should be taken against those who spread misinformation? It depends. If they're doing it because it's what they truly believe, that's fine. But if it turns out they're doing it to make a profit or for self-aggrandizement or to purposely hurt other people, then yes, I think legal action should be taken. Well, there's my 3 minutes. I'm up. Now I'm going to give a 2-minute update on the pandemic. We continue to see growth in deaths in the pandemic, approaching 5 million deaths. What worries me a little bit is the spike is coming down, the most recent spike, but looks like it may be leveling off right there. About 50,000 deaths last week. In the US, we see the same pattern with it coming down, but now a clearer leveling off, and that worries me. 750,000 deaths worldwide, about 11,000 deaths last week. Remember, this is not a pandemic that blows up everywhere at once. Right now, the deaths seem to be along a little bit to the west of the Appalachian Mountains and a little bit out in Oklahoma. If last year's pattern holds true, this will move up to the upper Midwest. We'll have to wait and see whether that happens. In terms of our region, now it is down below 200 hospitalized patients, which is good, but it's still a high number. But remember, 90% of hospitalized patients are unvaccinated. 96% of ICU patients are unvaccinated, and 97%, all but one of the patients on ventilators, unvaccinated. If you need any information to convince you that vaccines are the way to go, these are the data. So I've given you as many yes/no answers as I can, a 2-minute update on the pandemic, a great deal more information about COVID-19 on the College of Public Health website. If you know anyone who'd like to be added to our mailing list, please let us know. As always, thanks to Dara Young for editing, producing, and posting this video. If you have any questions about COVID-19 or about what I've said today, please let me know. I look forward to hearing from you. Thank you very much, and be well.